Senator Berger says the only people getting tested right now are those with symptoms, usually the worst symptoms. And he says North Carolina is shutting down its economy based on what he says is skewed information.
Take our foot off the gas a little bit on shutting things down, because there's no question that the economic consequences are significant and severe.
The Senate leader cites mental health and domestic violence as two examples of how the economic shutdown hurts North Carolina residents. He also questions the state's decision to slow down the economy in order to flatten the curve of COVID-19 cases.
We're not going to reduce the overall deaths as a result of the disease. We're just going to spread it out over a longer period of time in hopes that we don't overwhelm our healthcare system.
Berger says no one knows if North Carolina has gone too far or not far enough with its response to the pandemic. He cites a report by the World Economic Forum which finds testing a random sample of 5,000 people could predict the prevalence of coronavirus, and that wider testing to identify immunity could lead to less restrictive social distancing measures. As of this afternoon, fewer than 30,000 tests have been completed in North Carolina. State health officials this week discounted the need for random testing.
While testing continues to be an important component, now that we have widespread community transmission, we know testing only provides a limited picture of what's going on.
The state health director and the head of North Carolina's epidemiology department both say there are better ways to deal with the threat right now.
We have time-tested, validated tools to monitor impact here in North Carolina, and we have a powerful weapon against the virus: social distancing.
Senator Berger says North Carolina's decisions thus far have been made with the best of intentions on the available data, but that more data is needed to make better decisions.
It's better information than we have presently. It is information that I believe is needed in order to make good decisions, especially when what we're talking about is, in many respects, shutting down our economy.
Senator Berger has raised the possibility of reopening restaurants, a decision he says would be helped by random testing. In Greensboro, I'm Bill O'Neill, WXII 12 News.